Hey guys, so today we're going to be going through your Invisalign insert just to ensure you have all the correct information to help your treatment progress. So to start off with, each aligner is engraved with a U for upper and an L for lower. So if you're not sure what aligner you're onto or what if it's meant to go on the top or the bottom, you're always going to be able to find out if you head towards the back of the teeth. Make sure that we're never throwing our aligners away. We want to make sure that we keep all of our aligners and keep them in their labelled packet. So for Invisalign to work really well, we need to make sure that our aligners are worn for 20 to 22 hours a day just to help our treatment progress. The only time we take our aligners out is when we're eating, drinking and brushing our teeth. Other than that, they stay in our mouth. The only thing we can drink with our aligners in is water. We want to make sure that we're not having any fizzy drinks or any acidic foods with our aligners in because they can lead to what we call white spot lesions. So white spot lesions are irreversible. They're like scars on our teeth, so they will stay there forever. So not ideal. We want your smile to be perfect at the end of your treatment. So all of your attachments are tooth colored. The size, position and quantity, they all vary from patient to patient and they're all required to assist with your tooth movement. So some patients are required to wear elastics throughout their treatment and this is just to help correct their bite. So we'll go into more detail if we do ask you to wear them, but if we do ask you, they need to be in your mouth all the time. So sometimes we require IPR to be done. So this is polishing and contouring in between the teeth. It's what we call interproximal reduction. Sometimes we need to do this just to create better contact points in between the teeth, and it's just like fine sandpaper that we just put slightly in between your teeth to create a little bit more space. So aligner chewies are a really important part of your treatment. They're a little soft rubbery cushion and we use these just to bite down on every surface to make sure that our aligners are seated correctly. We want to make sure that we're using our chewies for 5 minutes throughout the day to ensure that our aligners are seated. We want to make sure that we don't have any windows between the teeth or the aligners. So cleaning our aligners is also really important. So our mouth is full of bacteria, so we want to make sure that we're cleaning our aligners every morning and every night. So we can clean our aligners with our toothbrush and toothpaste. Otherwise, we also sell this cleaning kit out the front. It has 60 tablets, a container and a brush, and all you need to do is soak your aligners in it for 20 minutes a day to keep them nice and clean. We want to make sure that you don't put your aligners in any hot water because they will melt. They're only made of plastic, and don't go placing them in mouthwash either, just because they will stain and they'll go a bit of a brown colour. So you're going to expect a bit of tightness and pressure. Your teeth and gums might also be a little bit tender. So the best thing to do for any dental discomfort is to take some Nurofen. If you can't take Nurofen, Panadol is okay as well. You're going to notice that you're going to get an increase in saliva flow. So our brain thinks that we have food on our teeth and it needs to create more saliva to wash it away, but it will back off and within a couple of days your saliva will be back to normal. You're going to notice that you're going to get a slight lisp, but again, it just takes a couple of days to retrain your tongue how to talk around your aligners. And sometimes we can get minor gum irritations and ulcers. It is very rare for people wearing aligners, but all we need to do is, if it feels like your attachment or your aligner is rubbing, break a little bit of wax off, and all you have to do is roll it into a ball and place it over the top of the attachment or the aligner that feels like it's rubbing. If you feel like you're getting any ulcers, we have some brace relief gel, and all you need to do is put a little bit on your finger and rub it into the ulcer. This will numb it for 20 minutes, and it also just helps it heal a little bit quicker because it has an antiseptic base in it. So if you find your aligners are rubbing or you have any rough edges, you can just grab a nail file and slightly file over those rough edges. If you have an attachment or a button come off, just give us a call, we'll get you in and fix it up. If you lose any aligners, always make sure you move up into the next one. So try not to move backwards. With losing aligners, make sure you keep them all in a really safe spot because if you do lose them, it is an additional charge to you for us to order some more. And then sometimes we can get some manufacturing errors. So sometimes they might send us 2 uppers or 2 lowers in a pack, or an aligner might be completely distorted. If this happens, take a photo and send it through to us and we can order some more on warranty for you. So we also just want to make sure that you're keeping up with your regular dental checkups every 6 to 12 months as well, just to make sure everything's healthy. So let's get started with dental monitoring. So dental monitoring monitors your progress in a lighter fit at a pixel level by using an artificial intelligence. Dr. Monkton reviews your treatment and he reviews your progress on a weekly basis. So he checks the fit of your aligners, he checks your bite, he also checks that all the attachments are on, and he also checks your oral hygiene. So dental monitoring is really cool. You spend less of your time traveling to appointments, and it also enables you to potentially change your aligners weekly. So never move past a stop sticker. So on your aligners you will find a stop sticker on some of them. So it's really important that we don't move past this aligner. We can move into it, just don't move past it, because it might mean that you need some of that IPR, or we might need to start some elastics. So if you're not getting any notifications, just check that your app doesn't need a software update, or it might need to be reinstalled. Just making sure if you're not receiving any emails from us that you check your junk and spam folders as well. If you need any help, we're always just a call or an email away. So always make sure that you're scanning when prompted to and you're following the dental monitoring instructions. So if you've lost an aligner and you've had to move up early, just make sure that you still scan when you're prompted to. So even if you've only been in it for 2 days, still scan. Each time we scan, we receive a go and a no-go. So if you receive a go, that's great, your aligners are fitting well and you can move on to the next one. If you receive a no-go, it just means that your teeth need a little bit longer to move. So don't be disheartened, it happens to everyone. We just want to make sure that you stay in that current aligner and really use your chewies well, and your app will re-prompt you in 3 days' time to rescan. So scanning with a scan box, we want to make sure that you're following the dental monitoring instructions, and we take 3 6-second scans. So the first scan is with your aligners out and your mouth is slightly closed like this. Then we're going to leave your aligners out and do another scan with your mouth slightly open, making sure when you open that your teeth are only a finger width apart. And then for the third scan, we're going to put our aligners in and do another one with our mouth slightly open. So just some golden rules before you take your scan, always make sure you clean and floss your teeth, just because the app will pick up if you haven't brushed them. Always use your chewies for 2 minutes before scanning, because if you do have any windows or air gaps, the app is going to give you a no-go, which will mean you're in that aligner for longer. Always wear your retractors when you're scanning. We want to make sure that your lips and cheeks aren't covering your teeth. And then selfie mode and iPads can't be used just because the flash isn't bright enough. And if you go on holidays for more than a week, just make sure you take your retractors, your scan box, and enough aligners to move into. So I like to tell people if they go on holidays for 4 weeks, make sure you take 5 aligners, just in case you lose one, you have another one as backup. And lastly, if your aligners, if you've got them out and you're eating your breakfast or you've gone out for lunch, make sure that they always go into their little black case. So we never want to put our aligners down on a serviette or a tissue or anything, because waiters and waitresses aren't going to know, they're just going to pick them up and throw them in a bin. So just making sure they're always kept in your little black container. So that's it for today. If you have any questions or concerns, please feel free to contact the practice or message us via the dental monitoring app.
Thanks guys.